traction because I'm very direct. So I don't
Right.
play with finesse. So I usually will say doing a chime check or whatever.
Good. Good.
Look at that. It's an impressive lineup. You guys are amazing.
I can't believe I still have the same haircut from junior high, I think. So I need to do something about that.
Count it all joy.
I'm can't see y'all.
I can see you on my right side of the screen, Maria.
Okay.
It might be a different setting or
let's see.
Good, thank you.
Good morning, everyone. As you join us.
Good morning.
So glad to have you with us.
Thank you, Shannon. Good to see you.
So, as people are joining in, I want to welcome you on behalf of the St. Paul Area Chamber of Commerce. What I would like to do is ask for you to check in this morning. So as you are joining us, we're having a conversation about health and racial equity disparities. And we would like for you just to report in regarding how you are feeling in terms of health. Either personally, what you feel that is the situation is doing to your overall health, or how you think that it's affecting those in our workplaces or society. So quick check-in via chat, which is good morning, I feel blank regarding health. And we're going to get started here in just a moment. We have significant amount of you that are already in. Okay. So I will give an official welcome. Good morning. I am Shannon Lemon with the St. Paul Area Chamber of Commerce. It is a pleasure to be here with you today. This is the third in a series of equity briefs. The St. Paul Area Chamber of Commerce has been doing equity work for about 2 years in partnership with all of you. We are not experts, but we are learning as we go along. And our charge is, how can we create a more equitable community focused on equity in action, providing opportunity for all and closing racial disparity gaps. And today, we're so fortunate to have some very phenomenal speakers, and glad to have them with us. None of this work is possible without our sponsors. I want to thank Bremer Bank for being our presenting sponsor. Although we cannot be in the Science Museum, we are still with them. They are our venue sponsor. We are fortunate to have program sponsor, which is the Bush Foundation, basically contributing a lot in terms of programming and guidance in the area of diversity, equity, inclusion. We thank our corporate sponsors, Anderson Corporation, Anchor Paper, Flint Hills Resources, Land of Lakes, Mille Lacs Corporate Ventures, Redpath and Company, Travelers, and Excel Energy. We want to thank our contributing sponsors, Sunrise Banks, University of St. Thomas, and again, thank all of you for being here. So this equity brief is just a bite-sized discussion. It's very fast-paced. What we're going to do is I turn it over to our partner and facilitator, Anika Ward, who will introduce our guest. We're going to first lay down the context foundation, then we will talk about the context, and we will have some discussion, and then we will talk about action. And without further ado, I'm so grateful for Anika Ward, founder and principal of Sankofa Leadership Network, and our moderator for the Equity Series.
Good morning, Shannon, and good morning, everyone. Thank you so much. It's a delight to be here again today. I want to thank the St. Paul Area Chamber of Commerce, B. Kyle and Shannon, for the invitation to continue this discussion with you all regarding our role and responsibility as leaders for helping to shape and create a more equitable and inclusive region. I am appreciative of all of the folks who have joined us, and we've got two wonderful, fantastic speakers who are also just beautiful people who are joining us today. Today is the third of our equity briefs, of our series of equity briefs. In May or in March, I want to remind us that we came together in person at the Science Museum to kick off the equity series, which was a six-month series. But we started off the conversation grounding us in a discussion of equity-centered leadership and the importance of understanding a challenge and not just working to undo the challenge, but creating a strong vision and then aligning your action to that vision. And so these conversations are a continuation. Now that we are no longer able to meet in person, we are having more frequent, shorter, bite-sized conversations that actually give us an opportunity to hear from even more folks. In the conversations that we've had reminders that the inequities and disparities that we're experiencing have been baked in, intentionally built in by the policies and practices that our institutions created, that our government has supported, and the fact that in order to undo some of these inequities, we're going to have to very intentionally, very deliberately bake equity into our work. In April, we began a conversation with Ms. Lissa Jones, who shared with us the 4 frames of leadership that are important at all times, but especially as we move into crisis management spaces that we're in. And April 22nd, Tanya Jackman Hampton came and shared with us the concept of knowing fear and understanding how fear impacts the way that we lead and the way that people hear us and feel us, and embracing that and using it, leveraging the wisdom that comes from those conversations about fear to move us to action. So today I'm really grateful to move us into a conversation that is entitled Building Racial Health Equity. It's our business. Mm-hmm. This conversation is built on the fact that we're all extremely aware of the racial disparities and cost of health inequity, all inequities in our society. This is being highlighted by this crisis, but we know it's been here, it's continuing, and there's something that we need to do about it. Time and time again, our state is recognized as one of the best places to live, and at the same time, we're recognized as one of the most inequitable, with some of the greatest inequities and racial disparities in our country. So today we've got some of our state's strongest champions for health equity, and they're going to lead a discussion with us about opportunities for action, a conversation about how we got here, what the opportunities there are for action, and what people are already doing in the state. So I'm excited to I'll introduce them both at the same time, because we will first hear from Bajang Mua and then have hear from Maria Sarabia. Bajang Mua leads health equity advocacy for Blue Cross Blue Shield of Minnesota, focusing on health inequity and addressing upstream determinants of health among all Minnesotans. His philosophy and action focus on integrating health equity into governance across sectors, issues, and cultural communities. Bajang championed Blue Cross's Health in All Policies investment and co-founded the Minnesota Complete Streets Coalition that led passage of Minnesota Complete Streets Law. And more recently, he chaired the Legislative Cultural and Ethnic Communities Leadership Council that catalyzed the Minnesota Department of Human Services agency-wide policy on equity. Maria Sarabia provides leadership and operational management of the Diversity, Inclusion, and Organizational Development Unit for Ramsey County Human Resources, growing an organizational culture that advances racial and health equity through policy and practice. Maria's background includes service at the city, state, county, and federal levels of government, and across industries in health and human services, civil rights and transportation, and public policy and administration. Prior to joining Human Resources, Maria served as Ramsey County's first health equity officer, where she helped to position the organization to deconstruct organizational barriers and co-create solutions with employees and residents. Without further ado, I want to pass it over to both Bajang and Maria, and then you'll hear us come back together right after each of them has an opportunity to speak and share their perspectives with you. We'll have a brief conversation, the three of us, and then we'll invite you all to chime in with your questions. We have got Q&A moderators that are helping us, and I invite you all to just chime in once we get to that Q&A section, because the moderators will be watching for the questions that you enter into the text box, into the chat box. And they'll just chime in and ask the questions on behalf of the folks that are typing them into the box. Without further ado, I'll pass it on to Bajong. Thank you both so very much.
Great. Thank you, Anika, and thank you, Shannon, for inviting us. And thank you, Maria. It's always a privilege to speak and act along your side in this cause. Earlier, it was mentioned that we're offering bite-sized information and a discussion, and I just want to acknowledge that we're biting into a huge iceberg here. But yet, we want to make sure that we can at least offer a primer, give you a sense of some of the root causes pre-COVID-19 and during COVID-19, and also illuminate what can be done in this time. I want to just begin with a friendly ding with Dr. Fauci. He did acknowledge the underlying health risks belong to pervasive health and racial inequities. But then he proceeded to say that, but there's not much we can do at this point. And I would just friendly and respectfully push back and say that, no, this is precisely the time to push back. And this is of the greatest relevance to health and racial equity right now. And so we can't table health and racial equity. This is the most important time to center it right now. In my remarks, I want to just cover a few things. I want to cover what public health says about root causes. I want to cover the relevance and impact on health and the economy. And then I want to outline a few strategic and pragmatic steps that we can take in real time. Shannon and Anika, please, in the chat room, flag or just nudge me. I come from an oral tradition, so I am rarely ever on time or in sequence with my points. So really quickly here, I want to outline what in public health we call the social determinants of health. And I would actually reframe it to be called the political determinants of health. And I don't mean political in partisan terms. I mean political in the sense that the conditions of health are created by decisions, by priorities, by who sets those priorities, right? And that these are not conditions that just arrive randomly in nature. And so that when we look at everything that has created health, and we know that 80% of what creates health is upstream outside of direct healthcare, outside of what happens within the four walls, okay? The other 20% is genetics, and direct healthcare is about 10%. And even genetics through the science of epigenetics is still being molded and shaped by your environment. And so everything we know about what creates health or the absence of health is mostly upstream, okay? That's in where you live, that's your economic class, race, gender, your geography, your education level, okay? So, and I wanna be very clear on this point that we are seeing health and racial inequities along the continuum there. It's not just occurring in the education system or in transportation. It is occurring in direct healthcare and along this continuum. And so with that kind of recognition, it's no surprise that when a pandemic comes along, it's going to illuminate, exasperate, and evolve these health and racial inequities that were already in place. Okay, and so part of what I'm saying may seem profoundly obvious, and part of it may feel abstract. And I'm happy to follow up with anyone on this call with resources or dialogue to flesh this out more. But I want to be very clear that these inequities that we're seeing in COVID-19, whether that's in the levels of exposure, the disproportionate levels of exposure in the workforce and our essential workers, the disproportionate rates of death and infection, to the very overt and explicit racism we're seeing targeted at the Asian American community. For me, this all belongs to the spectrum of racism, from internalized, personal, interpersonal, community, and structural. And then there's another overlay that we need to call out, which is implicit, explicit and complicit racism, right? And I just want to make sure that as we look at this pandemic, you can see all these layers vertically and horizontally around the causation of these health and racial inequities. So moving along, I just want to make sure that we as we grasp some of the root causes here, we understand that this is not just a moral imperative. It certainly is the right thing to do and the effective public health strategy. But what we know in Minnesota, just Minnesota alone, I was fortunate enough to partner with the University of Minnesota, Humphrey School of Public Policy, and the medical school just to quantify the cost of these inequities. And what we learned in Minnesota is that the differences in health has cost us $2.26 billion a year, $2.26 billion a year, okay? And that's in lost wages, that's in lost time in work, and this is all due to the preventable causes of death and disease, primarily in chronic disease, diabetes, heart disease, and not coincidentally, all the underlying risk factors for COVID-19. Okay, I'm not sure how I'm doing on pace here, but I want to make sure I can at least bridge to some action steps, and I'm happy to backfill or go back to make sure I cover these points more comprehensively. But I want to make sure that we understand that in light of the magnitude of this problem, you just don't sit back and admire or get overwhelmed by it, right? For me, what's essential is we have to, as we diagnose this as a structural problem, our solutions need to be structural, right? And that doesn't mean it happens only at the policy and systems level. It has to happen at the community level, at the deep personal level, right? It's all these layers compounded on top of each other. I just met with my CEO and my executive team last week, and just to talk about this very topic. And I asked them, how has the pandemic response team within Blue Cross, the largest health plan in the state, how have they addressed these health and racial inequities? And and I say this, I would say this if my CEO Craig Samet was here, right? But there was no dedicated team or committee or strategy within our pandemic response team, right? It was like a member on a subcommittee of a subcommittee, which to me actually illuminates some of the root causes of these health and racial inequities we are facing right now. Anika said it very well. We are facing inequities in leadership. We are facing inequities in power and decision-making, which then show up later in symptoms like food security, housing, business ownership, employment, right? Insurance coverage, okay? And for me, I want to be very clear that you can trace these inequities back to power, politics, and policy, okay? They're not just showing up randomly. So I think there's a great implication here for making sure we advance equity in leadership structure and in agenda setting and in how we make decisions. So the takeaway from that meeting with my executive team is that we wanted to make sure that we embedded health and racial equity into our corporate strategic plan. We want to make sure that our board has a dedicated health and racial equity team that is clearly focused on COVID-19, but also is established for the long term, that is rooted and focused on the inequities in insurance coverage and diabetes and chronic disease and tobacco use and unhealthy eating, that they can be mutual catalysts with each other, right? So in the near term, we need triage, we need to focus on the COVID-19 racism and inequities, but that has to belong to a long-range, durable strategy. Some specific things I would suggest for businesses to do is to develop and ratify an organization-wide equity policy, okay? The Department of Human Services did this. Maria and I, under our watch, we pushed the largest state agency, 40% of our state budget, twice the size of Blue Cross. And if I thought things were clunky and there's a lot of blue tape at Blue Cross, but like DHS is another beast. And if they could do this, then I think any state agency, any jurisdiction, any organization can do this. I pushed my own organization to ratify a policy as well. And so I think we need to make sure that we embed health and racial equity into our procurement, our contracting, our hiring practices, our communication strategies, our policy agenda, and our hiring, retention, and advancement practices. All of these things seem aloof or different or apart from COVID-19, but I would say that is getting at the underlying root causes of these health and racial inequities. And I would just overlay that as you do these long range things, you can build in a dedicated focus on COVID-19, because there are some things that are very unique and funky and disturbing happening within the COVID-19 inequities, right? So they're not mutually exclusive. I would just braid these phenomena together. We need to make sure we flatten the curve of both the racism and the virus, and we need to quarantine both of those things as well. So I think I ran over time, but I will leave it at that. I thought I saw a request for slides. I have a multitude of slides, and for this presentation, I thought it'd be better just to be just to offer remarks, but I'm happy to follow up with visuals and slides. So thank you, and I think I went over time, but I'll pass it on to Maria, who will help cover all the gaps that I missed and make sure that it's louder and stronger. Thank you.
Well, I know you shouldn't have gone first because he stole all my thunder. Very thorough. Well, so thank you, Vaijong. I feel like you've hit a lot of the points that I think are the pressing points as well. I could, one, just say thank you for taking time to spend with us this morning. And I'll give a little bit more of a backdrop. Vaijong started his conversation and his comments around political determinants of health. And when people say that, it sounds kind of abstract sometimes, and you think about, well, social determinants of health, I barely wrap my head around that. That's social systems, and then that's really impacting the individual, the person, the community. When you think about political determinants of that, I know that that term can sound jarring, and but I want to just unpack it a little bit, and I want to give a little bit of context. So I live in Ramsey County. I live in St. Paul. My kids attend St. Paul Public Schools. And if we looked at the historical context of how this has been a buildup over many years and many decades, and I would challenge us to say we're not in a space of accusatory or it's a certain, it's your fault or calling people out. We are calling people in to have these conversations and to shed light on how this has built up over years. We've inherited many of the challenges that we're facing now, and now is an opportunity in which we can work together in collaboration and cooperation through coalitions and cross-sector connections with very laser-focused intent and purpose to address the disparities that we see are plaguing our city and our region and our county and our state. The demographic trends show that we have changed significantly in a very short amount of time about who is showing up, not only in the workplace or who the new consumers are at various, in various business arenas, but the residents who live here. We have changed dramatically. So I want to first acknowledge that we're on Dakota land, and we recently had a birthday for Ramsey County. Ramsey County was established on October 27th in 1849. I want to acknowledge that there were people here before this county was established. St. Paul was established in 1854. The Indian Removal Act was created in 1830. Slavery ended in 1865. So here's hundreds of years of things that has nothing to do with us per se, that we have no direct connection to. But in communities, and I like how Vaijong was, I come from an oral tradition. Many of us have a loose relationship with time. So this does not feel like centuries ago. This is part of our history, part of our legacy, and part of our ancestry. If we fast forward into later into the 1900s, I technically, according to a ecological statistical study of social trends in Minneapolis and St. Paul, I live in the workermen's quarters of St. Paul. And so I live in the West End neighborhood and along West 7th. And So I live in the workman's quarters according to this ecological study from 1935. Um, I'm happy to say that we have evolved. We don't say workerman's quarters or what were some other terms where we still say Gold Coast. You can imagine where that was. That was a term that was used back then as well. Um, and they also used the Central Business District, which is, I think, today's downtown St. Paul. Also, just to give context, in 1935 is when we had redlining. So this has been a buildup, right? This has been baked in. It's been part of our systems and institutions. However, we've shifted. We don't use terms that are offensive. We don't have land covenants. You know, we are acknowledged about land covenants that have impacted home ownership and the options to build generational income, but we're aware. We have these heightened awareness of where we come from, and now we look at where we are. So I want to just sort of give that historical context and call folks to the space in which is a more of a what do we do now? So part of what we do now is acknowledging where we've been, and there's many frames that we can refer to in terms of knowing, you know where you're going. You can't know where you're going if you don't know where you've been. So, but there's three things. One, we can have policies, we can have compliance, and we can have quotas to help us move the mark around creating better systems, to have better outcomes, to be more inclusive, to prioritize diverse in spending, whether it's subcontractors with women or minority-owned businesses, whether it's how we invest in different priority areas. So that's one level, right? And then we can also do more of a organizational wide culture shift, and that's really around the equity plan and equity statement. We have a racial equity statement in Ramsey County. We also have a strategic priority that elevates that. It speaks to the organization that this is something that is very important to us. This is something we are going to invest in, and that we have expectations around. After that, you build these sort of infrastructure around your business or organization, and you do gentle reminders, probings, you track expectations around that, and then you change people's experiences. You change the way in which people experience showing up at work. You change their experience in the way in which they receive benefits or services or consume products from your area. And that is sort of the building blocks of how we can really impact and start changing some of the outcomes. I'm not going to delve into the health challenges. There are many of them. My call for you all today is to look at your power source, which is this chamber, all of the different businesses that are connected to this chamber across sectors: transportation, housing, manufacturing, social services, food industry, education, healthcare. Look into the authorities and the policies that govern how you do your work, and peel back where there is potentially negative implications that compound the challenges we're facing today. And I challenge us, if it is you in which you feel that you are not a subject matter expert, this is not necessarily what my strength is, we are calling for bold and courageous leadership to try and to tap into other people who may have a better understanding. One of the things we talk about is there's other ways of knowing. Oh, if it's not in a spreadsheet or a Gantt chart, but it's in somebody's lived experience, tap into folks who have a lived experience related to the issues that your business, your sector, your organization are connected to, and find out what are better ways that we can, what are some ways in which we can do our work in a better and more meaningful way to have a better impact. So those are sort of the high level things that I think about. I think that this group has an opportunity to activate, to build coalitions, to strengthen alliances. And the last thing I'll sort of say, just to kind of talk a little bit about the economic side, is when we think about economics and revenue, we have a situation in which we have organizations and businesses who generate revenue for our county systems. There has been a disruption. There is a pandemic. We know that businesses are suffering, and we know that residents and communities are suffering. We know that in the Black community and in the Asian community, in the Native American community, in the Latino community, that they are suffering more so than other communities. So we just have to name it, and we can pull the data that shows that. But we have a disruption, and we have to also hold our government entities accountable and work in cooperation from a local level government, private sector, and business perspective. This needs to be a all hands on deck approach to leverage funding that's going to be coming through, whether it's at the federal level, to work in cooperation with private dollars so that we can meet the needs of our communities and our residents, and so that we can sustain ourselves. This is not going to be a situation in which we're just going to do what we did last time. This is going to change the entire playing field as we've ever known it. So I would just give that call to action. If I had one call to action, it would be to work in collaboration and cooperation with one another across sectors, across industries, with government. And so that's my sort of plug. That's what I've been meditating on a little bit about. Sure, it's important. We must hold that historical context. What does that mean now? And then what are some concrete steps that we can take going forward to address the challenges that we face today? I see Nanika popped up, so I take that as my cue.
Yes, thank you so much. Bajang, thank you so much. We are going to move into a discussion with you both, but I want to thank Bajang particularly for bringing us into discussion about the social and political determinants of health, and how those impact our businesses and how we impact those determinants, and specifically to bringing us to the conversation about the disparities we're seeing are because of the disparities that exist in our institutions and in our government and leadership in power and decision making. That was really important. Those were a couple of really important highlights for me from your conversation. And Maria, I appreciate the discussion that you brought us to, specifically some of the history of the city and the areas that we live in, but the specific examples that you gave, that you and your team are doing, that we can all take examples from. The racial equity statement, the opportunity to create a racial equity statement and equity statements overall, to make equity a strategic priority and to embed it into the infrastructure of our work, and to begin to do some tracking to monitor and support the work that people are doing and ensure that they have the tools and resources. I specifically want to thank you for reminding us to see ourselves as a power source and understand ourselves as a power source, and recognize the St. Paul Area Chamber of Commerce as a power source, and to start to think about how we're plugging into those power sources that exist within our institutions and our communities right now so that we can make a difference. Right now, we're going to move into directly in a Q&A. I'm going to ask one question of both Bajang and Maria, and then we will take questions from the group. I see some questions starting to come in, and our moderators will jump in and chime in. We probably have time for 3 or 4 questions, and then a brief closing and call to action by each of our speakers. We'll ask them to chime back in. But the question that I'm going to ask you first is, both Bajang and Maria, maybe in a 20-second answer so we can move on to Q&A, I would love to hear both of you share something that has been most inspiring, something that is happening currently, that you see happening currently from a systems change perspective, that is most inspiring to you, that you could share with us. Who's doing the work? Where is promising leadership and change happening in a way that is most inspiring?
Maria, why don't you go first? I want to brainstorm a little bit. Yeah.
Vaijang referenced the Cultural and Ethnic Communities Leadership Council, which is a huge undertaking and an accomplishment, but I would like to just reiterate that served as a model for Ramsey County. So we had racial equity action teams, but because we're government, we also have an incident command team. And in a pandemic, there's a hierarchy, there's levels of government in which we need to work in this structure in our response. And we do have a racial equity command team that's really trying to look at all the data. So that to me was a clear indication that this is a priority, that Ramsey County is a county like no other county in the state of Minnesota. We're the most densely populated and the most racially diverse. I mentioned I live in St. Paul. In the St. Paul Public Schools, over 140 different languages are spoken. We know that we need to look at the racial and ethnic dynamics. I would also say that we've pushed St. Paul Ramsey County Public Health Department. There's only 14 states, to my knowledge, that are reporting on the racial demographics that are in terms of the implications with COVID-19, in terms of exposure, death tolls, infection, and testing. And so I think that is we're leading the nation in that regard. And that if we're able to have that data and we can pinpoint where there's an overconcentration of challenges, we can make targeted investments and we can apply strategies specific to the needs of the communities who are experiencing the most hardship. And if we don't do that, I would challenge us to still write the business case as to why we did it. Was it because we didn't do it because it was an administrative burden? Did we do it because we didn't have enough time? Name it. Because there's going to have to be a time in which we have to reconcile how this all came out and how we ended up balancing our book, so to speak, and where did the chips lay. And so that's really great. I think that we're tracking this by race and ethnicity. The data is a little bit skewed just because of our structures being old and the way we collect data, but it's a step in the right direction.
Yeah, and really quick, I think a couple of folks come to mind for me. Lieutenant Governor Gilchrist of Michigan, who really came out strong. He is leading the charge across the state to formulate a health and racial equity task force that is bringing together the full administration and the community. To me, that kind of leadership is so invaluable that he's centering it. He's calling it out. So I would look at what they're doing in Michigan. And then my mom, my mom, for the first time, she asked me for pepper spray because she was scared to go on walks, and she was scared of both the virus and scared of her safety for being harassed as a Hmong woman. But yet she also said to me, we'll be all right. I mean, she said this in Hmong, and there's no translation for this, but she said, we'll be all right. We crossed the Mekong. We've been through much more difficult things, and we're going to be okay. So it just made me really anxious and concerned, and then just gave me this resolution and resilience at the same time. Yeah. So I think that's 20 seconds, which is amazing. So, or less.
That's fantastic, John. I am trying to switch back and forth from to the questions. We've got some really good questions here. I'll just check in on one of them. So James is asking, hi James, he's asking, are we doing ourselves justice by framing the pandemic disparities in a racial framework rather than an economic framework? Can we create a coalition of the willing to address the policies that have significantly impacted those with low incomes, if we want to paint a picture that communities of color are the only communities with low incomes? I know firsthand unconscious and conscious biases have adversely impacted East Side St. Paul. Sometimes I think that is because the diversity of the East Side is limited in discussion. So the frame of the question is, are we doing ourselves justice by framing the pandemic disparities in a racial framework? Is there opportunity to also or instead frame them in an economic framework? And I'll pass that to whoever jumps in, Maria or Fajan.
So I have pretty strong feelings about this. I think it's, I think we are doing ourselves justice, and we have to lead explicitly, but not exclusively, on racial equity. Okay, you cannot water it down. I think we are in this predicament because we are shielding racial equity behind other frames, right? And with that, I think it's important that we build and acknowledge the shared struggles with different groups, whether that's the LGBT community, whether that's poor white folks in rural and urban areas, but we cannot mitigate that frame or shield it at all. I think to the questioner's point, we need to make sure that's not the only thing we talk about. We need to make sure it is truly interconnected but we cannot shy away from it.
That's really good and helpful. There, at our first equity series, Nick Alm from the Mosier Group was asked a question: do we need to focus on diversity in general, or should it be specific? And the answer is specific. Different populations and different groups have different needs and circumstances. And until we really drill down to the particulars of the groups that we're trying to serve, it is very difficult to stop the systemic and institutional impacts on our communities. There was another question on strategy, which Maria, you really nailed quite nicely. The thing that I always think about is how are the people that are conducting their jobs, playing their roles every day, able to influence equity in the decisions they're making. And as populations, people are being furloughed, staff are being asked to work on the front line, you know, how are those decisions made, and what type of management decisions for the team members as well as the communities that corporations and organizations they serve can be made today with health equity in mind? Either of you.
So I'm trying to pull the question. The question is, how could we address our day-to-day business operations to focus or have a priority in the equity lens? Okay.
Absolutely. Much better stated.
I like your vibe though. So I guess my response would go back to the way we're organized. We have policies. We can set quotas. That's sort of a older frame, but like we're gonna meet at X benchmark. But we can have policies. We can have compliance approach. And then in terms of changing our organizational culture, we need to have learning and development opportunities. We need to have new ways of understanding things beyond sort of technical data and information, experiential learning. I also think of, I've worn many hats over the years, but like on-the-job training, creating ladders and lattices. So as you make a business decision, you can tap somebody within your organization who is like, oh yeah, you used to work over there in operations. Oh, you did have experience at the front desk. And then you get a different view and a different perspective, and you get different contributions and data points when you're at a space in which you need to make a business decision. Oftentimes, the front desk or the admin support or the folks who are in the day-to-day sort of very transactional, they can say, oh yeah, that hasn't worked very well and for a very long time, and this is what we have to do, and there's this workaround, and then we do, and these are the things that if we tap into those voices and tap into different perspectives and get new wisdom about how we're doing our business, we can increase efficiency, we can advance equity, and we can be more effective in what it is we're trying to accomplish here. So I would say create the policies, try to address the behaviors, create a culture, and then for actions, I mean, challenge yourselves. We need bold and courageous leadership. And we need to, and I would also say if you're a leader in which you are leading an organization or an area, if this is not your strong point, but you have a sense of curiosity and you have a sense of willingness, you might not fully understand it, surround yourself with people who might be closer in terms of proximity to the challenges we're trying to address, and lean on them, grow them, create space at the table to also share power in your decision-making process.
Thank you. I think we have time for one more question, and then we'll bounce it right back to Maria and Vajong after that question to give really short closeouts and move the conversation towards closing. So one more question. Does any one of our facilitators want to ask?
I think that what we're kind of seeing in some of the responses is that this is an area where a lot of people don't have expertise, and maybe it is not necessarily integrated into the DEI conversation. And so how do we make this a central focus of diversity, equity, inclusion work in terms of what types of things should leaders be thinking about And how do we bring it to the central lens? Just as we had to maybe be more intentional to have a racial discussion, how do we bring health inequities to the table consistently?
Yeah, I know Maria will have a lot to say about this too. But for my organization, which is a health insurance company, I think the case is both a moral and mission based purpose, right? So yeah, we sued the tobacco industry in the mid 90s, but we also understood that the leading causes of preventable death and disease were caused by tobacco use. And so we need to understand that addressing health and racial inequities are actually imperative for moving our business and our core values. And so they're not separate. It's not something you do out of charity. It's not something you do out of just goodwill. You do it because you understand the long-term benefits to saving lives, saving costs, and advancing health equity. And I say that cautiously because for me, the grounding and the starting point is around social justice and advancing health and racial equity. But we need to make sure that the case is airtight, that it's about retaining a strong and talented workforce. It's about long-term costs and making sure that we see the shared and common problem and common solution.
Well, I want to thank you both so much for this important conversation. I want to bounce it right back to you two. If you've got maybe a 30-second to 1 minute challenge that you would like to share with all the leaders on the line. So Vajang, since your photo's up, we'll start with you.
Okay. We covered so much, and there were a lot of questions around like practical, immediate things to do, and I would posit that the challenge we're up against isn't a technical problem, right? There's no manual, no toolkit, no how to do solution here. Although there are plenty of that, and I would actually point you to Maria, and I saw a great friend and mentor of mine, Antonia Wilcoxon, on this call. There are great equity templates on how to devise policies, procedures, training, so that we understand that the equity is not just a lofty principle, it is a praxis, okay? And that we have to terraform equity into the way we build and create our organizations and our environment. And so I would just say match solutions with the magnitude of the problem and center on power. James' questions earlier about building strong partnerships, to me, you have to put equity champions and positions of power within your organization so they can have deep, meaningful, lasting relationships with folks and organizations outside of your organization so that the bridge points are very strong. And so I would emphasize doing a power overlay and analysis and make sure that there is real political and financial investment in your equity work.
Thanks. So yeah, I think there is a structured approach. I think if we all pulled back the veil of what our checking account looks like and where we spend our money, that's going to tell a lot about what is important to us. And I think that is the same case for organizations. I would say transparency in a time like this is critical. And work with your board, work with your leadership, work with your accountant, and start looking a retrospective view. Where have you had your investments, and what are the times have changed, circumstances have changed, what are the emerging needs, and what type of new investments do you need to make? And I say that in a time in which we know that we're in a fiscal crisis, but there's gonna have to be a prioritization, and it's gonna have to be at all levels in which we're gonna have to start saying, what are we doing, and what is our focus here? The one other thing I would just add is this has to be a joint effort. I think if I cited a lot of demographic data earlier on, and we know that the younger generation is going to be the most racially diverse generation that our country and our region and our city and our county has ever seen. With youth comes new ideas and different experiences and visions. And I would say if we really wanted to be, not only do we have an equity plan, but think about who this is. I testified at the legislature and I said, I have a kid who's going to graduate from high school in 2034. They laughed. I'm like, that's not that far away. I have to start saving for college now. So think about like, who are we trying to impact? What is, in the indigenous communities, the 7 generations, where are we wanting to go? What do we want to leave for as a legacy? Tap into youth. They have a vision, they have power, they are the future, and build a plan and hold folks accountable and use benchmarks. And again, I would just offer, I'm going to give my cell number, 612-400-2872. That's my work cell, 612-400-2872. I encourage folks to email me, call me, text me, like, let's keep a connection and we can sort this out together. Not one person is going to have the golden answer, and none of us have a golden parachute, none of us. This country doesn't have a golden parachute. So we need to work together through these times.
Thank you so much. And thank you to the folks who have asked questions to create this really important, powerful conversation. Specifically right now, I wanted to give a bunch of snaps when Maria, some of the things you shared, the importance of new people coming into spaces of power and sharing new ideas. Like young people, I am a huge proponent of hearing from young people because they haven't been embedded in these systems the way that we have. They haven't accepted in some cases. Even the strongest equity champions are accepting some things from the system that young people just will not accept, and young people have ideas about how to change. So I think that's a powerful message. I also want to thank you both for the conversations around data. And the importance of collecting the right data of the organization, of our cities, of our states, building practices that allow us to collect the right data that tells us the story about how we can change and create new targeted investments. I also want to thank you both for the focus of the conversation. I heard the word solutions many, many times. And Maria, there was a point where you talked about, looking at the data, thinking about how we create new targeted investments, and thinking about and being aware of the fact that solutions can increase efficiency, increase effectiveness, and advance equity. And that's how we need to be thinking. It's not an either or in any way. We can have, if we think and act in a way that's most creative and most innovative and most visionary, we can have solutions that are real solutions for our business, for our community, and for our people. Maria, you also brought up the conversation about a sense of curiosity in this conversation. And I want to leave us, as we close out, with just a little bit of what I am thinking of as a systems change plug. As I was thinking about our conversation today, for some reason, I started to really have a conversation with myself about pattern recognition. And the importance of, as I was raising my children, I have 4 children, and each one of them, you have this milestone in their development, early in their development, where your caretakers or the physicians are saying, they should be able to recognize patterns at this point. And I could think for all of my children at the point where they would say, look, Mom, it's a pattern. They learned, and in school, they would start to think about and practice pattern recognition. And there was an important, maybe at age 4 to 6, a point where a couple of my children would get like really enthusiastic about identifying patterns in the world, in the clouds and all over. And they'd say, Mom, it's a pattern. And I think it's really interesting because as they got older, they would have issues in school. And I would say, are you noticing the pattern in the way that friend is treating you? And the interesting thing about our how we evolve and understand patterns is that we have an opportunity to then adapt and think about how we can, as we think about ourselves and our outcomes and our inputs as part of a system, we can think about the power that we have. And so when my child comes home and says that they're frustrated about something going on in school, what I've learned to do is then ask, so are you noticing a pattern? Are there adjustments that you can make to change the outcome? So maybe it's not that just that child is mean. It could be that you've done something that's inadvertently taught some behaviors and enabled some behaviors. And so, you know, I want to just think about our reaction to those patterns. When we're in our organizations, we notice there might not be people of color in leadership in the organization. And thinking about a systems change, a systems thinking perspective versus a cause and effect. We could say we don't have people of color in the organization, and that's probably because there's not enough qualified people. So cause and effect, we could say that's probably just a coincidence, or we can say, what can we do differently to change the system that we're in so that we might get different results? It's not a placing blame, but it's an accepting responsibility and power. And so I want us to remember that the patterns are valuable, the patterns that we see, you know, in this conversation that is really evolving and hopefully evolving in really positive ways about health equity across the country and in our communities. I think it's really important that we recognize how we saw patterns, and we recognize them as, you know, that's because those people, or that's because whatever, and we accepted those patterns instead of thinking about, as businesses and organizations, what can we do differently to perhaps create different outcomes. And that's what I think I heard from both Maria and Vajong today. It's our job as business leaders to identify the specific actions and find the partnerships and opportunities and relationships that can help to leverage our action and to move us into success. So I want to remind us that we can make a difference. These problems, these inequities seem and are huge and are frustrating and concerning. And sometimes it seems like what we can do will be a drop in the bucket, but we need lots of drops in the bucket. And so we have to each make our contribution. I would love to share a quote that's attributed to Maya Angelou. If you don't like something, change it. If you can't change it, change your attitude. I appreciate you all having this conversation today. I want to pass the mic over to Shannon to close us out. Thank you all.
Thank you, Anika, for all of your great words and thoughts and for weaving us together through this process. Thank you, Vajong and Maria, for your time and wisdom. We definitely would like to keep you engaged. We will post, Vajong, information that you have for us on our SPAC Equity LinkedIn page. Maria, you're gracious in offering your services, and this work is about us creating a community. How can we develop best practices? How can we learn from one another? How can we be mindful of our own actions, but how can we move our organizations to action in order to bring about the change? So I encourage all of you on our session today to reach out to one another, but then also to reach out to our presenters to begin to figure out how we can do things differently. And that is the point of the brief. The last question for you is, what are you going to do differently today based on this discussion? And even if it is having conversations with different people in your organization to get a new perspective, make a commitment to take a step to make a difference today. And as we sign out, maybe you want to report out on the one thing that you will do differently. Our next equity brief will be at 8:30 a.m. on Wednesday, May 20th. Again, thank you for our sponsors, and thank you for this wonderful community of practitioners who are doing the work and getting things done. Hoping you have a wonderful Wednesday, and look forward to seeing you on the 20th of May. Be good and be kind to yourselves. Thank you.
Thank you, everyone.
Thank you.
Thank you.